think each person ends up on that journey and coming to different decisions for themselves. For some people, they absolutely know they're going to have children, want to have children.
I'm Heather Grish, and this is the Wisdom of the Body podcast. This podcast explores the idea of body intelligence as the real key to learning the knowledge of life, or what we call Ayurveda in the ancient language of Sanskrit. We do that by connecting with today's creative leaders and experts who will help you listen to your body, trust your gut, and live in deeper harmony with nature. Come join me as we unlock the golden door to clear, direct perception and become very deep listeners. You can find the Wisdom of the Body podcast on Apple, Spotify, and Stitcher. You can also follow us by joining my email at heathergrish.com or on Instagram at heathergrish. I know you're going to love this podcast, so take a second right now to subscribe. This is the first of 2 episodes on fertility from an interview that I did with Dr. Cindy Duke. And this first episode that you're listening to will cover the state of reproductive health. We'll talk a little bit about PCOS, and we'll talk a little bit about sort of the differences between conventional medicine and functional medicine or integrated medicine or other types of quote unquote alternative medicines, and Dr. Cindy's take on why those splits exist in our society today. And we'll touch a little bit on COVID vaccines and COVID effects on female health and the menstrual cycle in this particular episode. So grab your favorite cup of tea or chai, or get ready to go out on your walk, or whatever you normally do when you listen to this podcast, and get ready to enjoy this interview with Dr. Cindy Duke. Today, I'm here with Dr. Cindy M. Duke, who is America's only dual fertility expert and virologist. She's a highly accomplished Johns Hopkins and Yale-trained physician, scientist, entrepreneur, blogger, podcaster, motivational speaker, philanthropist, content creator, and influencer who speaks and writes about issues as they relate to life, health, fertility, female empowerment, and international telemedicine. She is the physician founder, the medical and laboratory director of the Nevada Fertility Institute in Las Vegas, Nevada. Dr. Cindy has a very engaged social media presence with a monthly audience reach of over 250,000 people across multiple platforms, where she is a highly regarded influencer. Her hobbies include gardening, photography, baking, and writing poetry. Thank you so much for being with us here today, Dr. Cindy. I'm so excited to have you.
Hi, Heather. Thank you so much for having me. I'm really excited. I've been looking forward to this, and I can't wait to just go through this conversation with you. It's always fun.
You're one of the more interesting people that I've ever heard talk about reproductive health, also about assisted reproductive technologies, and about certain medical conditions like PCOS, things like that are very common. And I really mean that. You're one of the most interesting people I've ever heard talk about it. So I'm really pumping you up here for the audience.
Thank you. I think part of it probably has to do with the fact that I work really hard on having these conversations in layman's terms and really trying to make sure that when we have the discussion, it's not coming across as this science-y, statistics-based, but really in a way that people can identify with. People can say, oh, that's me. Oh, that's my family member. And thereby, hopefully, they can take more ownership of their own health by so hearing things that they can identify with.
That's really helpful. And I would imagine that with the background that you have and the experience that you have, that you're probably quite in demand right now.
It's been busy. I'm enjoying it, but it's also interesting because as the only fertility doctor and virologist, what it suggests is not many people ever thought the two went together. And so suddenly here we are at a time in our lives and our world where people have so many questions as they relate to reproductive health, fertility, family building, virology, specifically COVID. But it's also an amazing opportunity for me to introduce all the other types of viral interactions that do dictate our fertility and our reproduction and our hormones and our general health. Because viruses altogether, when we think about the microbiome, are the one part of the microbiome that don't really get discussed much.
Yeah, definitely. And that's such a popular thing to talk about right now. But yeah, that part's getting missed.
Yeah.
So this is a big question to start with,
Mhm.
but let's go for it. How would you describe the state of reproductive health today?
I would say state of reproductive health is currently in flux, but it's in a positive evolutionary flux. And I think it's in part because for a long time, reproductive health has been guided by a rather patriarchal approach to reproduction. And of course, usually when people speak of reproductive health, they're really referring to the health of people born with uteruses and ovaries. But what we're now recognizing is first and foremost that burden of reproduction, and i.e., the continuation of humanity that has been placed squarely on what historically we've described as women and women's roles, actually involves just as much the persons who make sperm, right? And most of us who talk about reproductive justice, that's been what we've been out there screaming about. It's not one sided. And so what we're seeing is finally the conversation and the narrative of reproduction actually involving all the pieces and the players. And so that means, in terms of reproductive healthcare delivery, we've certainly seen a lot more women coming into the space as the deliverers of the care, the ones taking leadership roles in reproductive healthcare delivery platforms, whether it be at the hospital level, the clinic level. Certainly we're seeing more femtech because we have more women going into the space and saying, hey, where's the tech as it relates to things that affect us? And of course, recognizing that reproductive health extends beyond making babies. I think for so many people, when they hear reproductive health, they just think it's this very restricted space where we're talking about having babies. But really, reproductive health has to do with all the functioning as it relates to menstruation, ovulation, the way your uterus works, whether you have pain, whether you have endometriosis, fibroids, perimenopause, menopause, and beyond. And so I think that's the positive flux that we're in. I'm loving the momentum, and I'm loving that we're taking charge and we're seeing change, right? So we have ASOS, which is as seen on screen, which is a big clothing brand in the UK, announcing that they're now going to provide health benefits for not only those who've delivered babies, but for partners or carers of those who've delivered babies, coverage for miscarriage and pregnancy loss, and coverage for menopause, right? And we just saw Kellogg's also announce that they're implementing similar health benefits and overall benefit plans to cover the same spectrum. And this is incredible, Heather, because certainly if you looked even as recently as 10 years ago, in the workplace, menopause was not something people talked about. People didn't acknowledge menopause or acknowledge the active changes that were happening in someone's bodies and the fear. I say this as someone who manages hormones for patients who are perimenopause, menopause, and the fear of being found out, so to speak, at work. That, the fear of what if I have a hot flash at work, that will completely undermine the respect that people have for me. And just imagine having to live that way when it's a natural process that happens with some of us. And so I really am happy about where we're going. We have a long way to go, but we've made so many strides in even just normalizing the conversation, but also acknowledging the fact that when we talk about reproductive health, we're really talking about the health and well-being of greater than 50% of the people on this planet.
Wow. Yeah. And it seems also that in terms of the reproducing factor, that has changed so much because generally we don't have as many children as our grandmas and our moms did. And, as the
Mhm.
population increases and as the birth rates are changing, what do you see happening with that? Do you think there's actually like some correlation between population growth and this is probably just theory? I don't know if anybody's actually studied
Mhm.
it, but the correlation between population growth and birth rates?
Well, it's an interesting paradox, right? Because on the one hand, we are actively talking about the fact that the population is the largest it's ever been on the planet. And in most countries, their population size currently are really large. But speaking to that very point that you made, which is our birth rates have actually dropped significantly over the last 40 years or so, what it really means is if we look ahead to about 60 years from now, what we're expecting and anticipating is that there'll actually be a major contraction in the number of humans on the planet because we're not actually reproducing at a rate that would be enough to even replace the number of people we have currently in most of our developing countries, actually developed countries around the world. And so it's paradoxical because, on the one hand, we are talking a lot about the impact of human action on our planet and the rapid rate of growth in our populations and what that's done to other populations on the planet in terms of our flora and fauna. But at the same time, looking ahead, what we're also seeing is we're not really reproducing humans at a rate in many spaces that would replace what we currently are at in terms of levels. It's very interesting.
It is really interesting. And I think it presents a psychological challenge for a lot of people who are trying to reproduce now
Mhm.
when they compare themselves to their moms or their grandmas. And the world was really different than,
It
50 years
was.
ago, right?
It really was.
And then so it's like one of those things that everybody starts pressuring people like, when are you going to have kids? And you're like,
Mhm.
things are different now. Let's just, take this a little slower. So this is really important work that you're doing. What informed or drives your journey to the person that we see today?
Yeah, I love that question in part because it goes back, believe it or not, to my upbringing. So I grew up in a very small island in the Southern Caribbean, Tobago. It's part of the country Trinidad and Tobago, which is two islands. And there were just so many interesting microcosms as I was growing up that they very much informed my interest. So, one in what keeps human beings around? How do we get here? And that's part of what led me ultimately to the journey of, high school, being a biochemistry major, in college, and ultimately becoming an OBGYN who wanted to do fertility, which is studying hormones and the biochemistry of the human being. But also, it's what drove my interest in science and specifically leading me to virology, because I was very much interested in not just how we as humans come about, but what is our interaction with our community and what are those specific interactions with the other life forms on our planet that basically inform how we evolve and how we thrive as humans. And so that was what led to my path to where I am today, which is this dual fertility doctor and virologist who's very interested in reproductive health justice, but also climate justice, and actively letting people know that reproductive justice and climate justice are one and the same. And I'm always happy to expound why I think that. But recognizing that our activities, as we were just talking about, impact our environment, but that interaction means, for example, if we're seeing changes with our climate and changes with how we encroach on the natural habitat of the different animals and their food sources on this planet, means we're also going to be more and more exposed to different things like, emerging infections and emerging viral infections like SARS-CoV-2, and how that in itself is then going to drive how our population grows and how our population interacts. And if anyone is unsure of what I mean by that, just look at how our world has changed in the last 2 years, all the different things that have had to be imposed to try to keep humanity safe as a result of such an exposure to a novel virus. And make no mistake, if we talk about how many viruses are out there within the animal kingdom, the non-human kingdom, and how many our bodies have never seen, it's innumerable. And what that means is the potential exposure is quite great if we're not actively out there talking about the impact, talking about what we can do to keep communities safe, what we can do to ensure that people have the opportunity to grow their families, build the families that they want, but also not inadvertently endanger themselves or the world at large.
Oh, yeah, that's a big topic. It's something that I'm super passionate about too, that sort of intersection of how we relate to the environment and what that does to
Mhm.
our fertility and what our fertility does to the environment as well, and how many beings were popping out onto the planet. And I know it's a big deal, especially with the generations that are younger than me. You know, me being in my mid 40s, it feels really like the
Mhm.
millennial generation that's something that is really on their mind a lot, is what I found, to the point where it's actually like becomes an existential thing for a lot of them to
Yes.
even contemplate whether or not they should have children.
hmm Which is shocking, right? And, we all probably, or many of us are probably familiar with the so called rumors that say that's one of the things that may have led to a rift between Prince Harry and his wife and his brother and his wife, which was the discussion of how many children should one have if you're concerned about the environment and the impact that our personal lifelong carbon footprint has on the planet. But when I saw that story, I thought it was quite demonstrative of what is the issue at hand here. And you're right, we literally see people asking themselves, should I have children when it comes to the concept of protecting the planet versus what is that natural drive to reproduce? Because in many ways, right, reproduction is in many ways the drive is innate and it makes sense for the replacement and the continuation of the species. And so I think it's interesting. And certainly it's what leads to a lot of the conversations I end up having with my patients. Not everyone knows if they want to have children. Not everyone knows that they definitely don't want to have children. And so what that means is having these conversations where we sit down and we explore and we talk about options. And certainly along the way would come up conversations like egg freezing, et cetera, speaking about the realities of an egg freezing process, but also keeping it realistic about the expectations of the outcomes should one freeze their eggs and come back to talk about it later for using them. But it's an existential concern. And it's also one that to our older family members and community members seems weird, right? It's near impossible for me to speak to my mom, who's in her late 60s, and talk about sort of that existential idea about reproduction and making more, making progeny. She sits and she listens, but then she'll share what it was like when she was growing up. That wasn't even a thought, right? It wasn't a thought. It was just sort of automatic. At one time, you're going to start having kids, was sort of the expectation there. And so we are in a different place. And I think each person ends up on that journey and coming to different decisions for themselves. For some people, they absolutely know they're going to have children and want to have children. And so when they think of the environment and climate, they're asking themselves more, what is my responsibility as a human who's going to be making other new humans to the environment? How can I do things that helps me decrease my carbon footprint? How do I decrease the impact of plastics on the environment, etc.? But then we're also going to meet, as you so eloquently described, the person who says, you know what, I don't want any children because I think I'm already having too much of an impact. And in addition to doing all the other things, I'm just going to make a conscious decision not to have children. Or you may say not to have biological children, but I'll go ahead and adopt or I'll go ahead and foster. So, I like to let people know it's a spectrum. I like to make sure people know that it's all acceptable. I think, sometimes when we get into the declining birth rate conversation, it can lead some people to feel guilty, like it's a subliminal messaging that says you are harming humanity if you're not actively planning to reproduce. And we certainly see language being used out there, whether it be religious or social groups, that sort of telepath that message to people. And that can be quite hurtful because I think in the end, that really is a personal choice. And there are some people for whom the notion of reproduction it's not an interest of theirs. And we need to honor that in that way.
A lot of people know that I got pregnant with my son on the first try and had him the year I turned 40. But a lot of people don't know that I first tried to get pregnant in my early 30s. The journey to motherhood was the most frustrating journey I have ever gone through. And that's what prompted me to write the book, The Ayurvedic Guide to Fertility, about the methods that ultimately helped me through that journey and helped me come out healthier, more aligned with nature, and frankly, more mystified on the other side of it. So if you're really stumped about the things that are within your power to change in your fertility and reproductive health, and you are curious about what you might be able to activate by getting more in touch with your body through the methods I used, then connect with me on Instagram, because there are definitely ways to go through the process in complete surrender. So find me on Instagram at Heather Grish. That's at Heather GRZYCH. Yeah, I learned after my book launch last year, I learned the term antinatalist, which I didn't know before that. And I was like, oh my God, there are people that think reproducing is evil. Oh my God. Yeah, so it is. There's a lot going on in people's heads. And it seems also that maybe because women have changed a lot. We'll say people with uteruses. I know that gets kind of sticky. My language is very heteronormative typically, but
it's okay.
I have that bias for sure in my brain. So basically, it just seems so bizarre that there would be people out there that, think having children is evil. But, I see where they're coming from too. There's so much going on in people's heads right now because there's been a lot of changes with women or with people with uteruses, and the lifestyles for that population have really changed a lot, and the options. And this goes, I think, earlier with what you were describing about the shifts that are taking place in reproduction and this positive evolutionary flux where there's a lot more awareness of even choices that people have today. And it's interesting how much there's just a lot more thoughtfulness going into things in general. And part of that too is people becoming Dr. Google, which frankly, I know that gets kind of a bad rap sometime, but there does seem
overall
to be,
it's a good thing.
Yeah. Well, because there seems to be a big disparity between the average person and a medical doctor in terms of awareness about human bodies. And it feels like that disparity of knowledge and understanding it just gives people a disadvantage when they think about their own bodies because they don't know. And so it's good that they're trying to educate themselves in whatever way they see fit, in partnership and guided by their medical team is wonderful. And there's a lot of women right now that are suffering from different types of medical conditions. So many women now having diagnoses of PCOS. And one of the things I find interesting about that particular group is a lot of them seem to maybe have some, but not all of the symptoms of PCOS and aren't sure whether they have PCOS. So I was kind of wondering if you could talk about what makes something specifically PCOS or polycystic ovarian syndrome. I'm sure you'll go into a much better description of it than I can. And when something is similar to PCOS, but technically not that particular diagnosis.
I would say that PCOS, as you shared, Heather, is one of the more nebulous diagnoses because it absolutely doesn't look the same in every person. And so it's not cookie cutter. And what that means is there are countless persons who have PCOS who go years without receiving their diagnosis because perhaps they didn't quite fit the stereotype, right? So if we examine the stereotype says that PCOS means you're someone who's struggling with your weight, you've got a lot of acne, you've got hair growth everywhere, and you don't have periods. But the truth is, that is actually a really, really small subset of people who struggle with PCOS. So PCOS is a medical condition, emphasis on the S being syndrome. And as with any syndrome, you can have a spectrum of different ways that you present. And so what it means is you have a health condition that literally actually impacts different hormonal systems in your body. And of course, hormones are our body's messengers. These are the chemicals that travel within your blood to talk to different organs and how different organs interact and trigger the human that we see. And so, what that means is you can have different levels of the same hormone in different people. You can have differing hormones impacting different things. And as a result, you see that variety and that diversity in how people present with PCOS. And so, the first step is if you're someone who thinks you have PCOS, is identifying the right specialist to help you navigate and get to your diagnosis, as opposed to trying to jump online or trying to be fit into a box. And as clinicians, that's something that we're not doing very well, to be perfectly honest with you, which is many clinicians, when they first learned about PCOS, maybe just they skimmed the surface of what we know. And in fact, the evolution, as we talked about, that flux, the knowledge on PCOS is really exploding in the past 10 years because we've finally been doing more research on it and really investing in understanding this disease process more. And so, certainly, part of what we're seeing is if someone only glossed over PCOS, maybe they had one lecture when they were in medical school, nursing school, whatever their professional school was, they really only skim the surface or scratch the surface even what PCOS is. So if somebody shows up to them and says, could I have PCOS? They're already starting off very limited in how they're able to help that person, that potential patient, because they don't know enough. And so a lot of what I do, and you've certainly heard me in, for example, our clubhouse rooms where we have a whole room dedicated to PCOS, because I felt strongly that PCOS is not a conversation you have in passing. And it's one where you actually have to actively educate and advocate and teach people about it, not just the potential patients, but also starting to re-educate clinicians. Because the truth is, if you reach out to clinicians and you literally just said, can you define PCOS? They'll all be able to tell you it stands for polycystic ovary syndrome. They'll all be able to tell you that maybe it causes period problems, but then they kind of get stuck after that. Many of them aren't even fully understanding of our diagnostic criteria for PCOS, which is known as the Rotterdam criteria, that literally takes into account the multiple varieties and variations of how people with PCOS can present. So what's my point here? My point is, when it comes to PCOS, I understand that many people are confused by it. And I especially understand that that confusion, especially amongst clinicians, has actually led to a lot of frustration and even, let's be honest, some harm and trauma to the patients. Because imagine being dismissed, Heather, for 8 to 10 years, where people are telling you it's in your head, nothing's wrong with you, you just eat too much, you're this, you're that, or maybe you're that lean PCOS, because the truth is the majority of people with PCOS don't fit the stereotype. The majority of people with PCOS are normal weight. They're not overweight. The majority of people with PCOS ovulate regularly and have regular periods. And yet all you read about, sadly, earlier on, and what was in the textbooks, was the stereotype of the overweight, non-period, acne-prone, hirsute person. And so that's the first thing, is just redefining what PCOS looks like and explaining that there's a diversity so that we can unmute those people who have since felt dismissed and are hiding with this unknown thing that they don't know what they have. But also opening up the conversation such that those who do want to know and to understand their PCOS can take charge. Because what we also see is some predatory marketing happening around PCOS, where there are people out there marketing things like saying this is the only diet that can cure you. And so we're seeing more people actually ending up being harmed because they're not being helped by the so-called only diet, but now they think they're further broken because the diet didn't work. But the truth is there's no one diet fix for PCOS. There's no one hormonal fix for PCOS. There's no one exercise regimen for PCOS. And depending on the type you have, yours needs to be personalized. And we need to understand what's happening in your individual body as those different hormonal changes interact with each other and the different inflammatory processes interact. So that's what I would say about PCOS, is to first give grace to the person who either knows that they have PCOS or thinks they might have PCOS, giving you grace to say, it's not in your head. You likely have something going on and you need to find the right support team. Then the second is really reaching out and advocating that clinicians who care to deliver services to PCOS patients become as educated as possible. You can't skim the surface. You cannot skim the surface or scratch the surface of PCOS and call yourself a PCOS specialist. You're going to do more harm than good. You really are going to have to immerse yourself and learn all about it, the diversity of it, the spectrum of it, and break out of the stereotypical box, because that's what happens. Patients come and we try to box them in. And if they don't fit the box, we say, well, you don't have it, and we leave them to have more harm. So that's what I would say.
Yeah, this label thing that you brought up, it's, our minds really like to say, okay, I have this label, I know what it is,
Mm-hmm.
and this is what I do when I have this label. I can take an action
Mm-hmm.
once I have this label. And our brains love to want to get there. And it seems like a lot of our educational systems are really designed to make us think like that in some way as well.
Mm-hmm.
And it's funny
Mm-hmm.
because I remember when I was writing my application to get my master's in Ayurveda, I sat there, I was like, I don't want this learning, because the same thing could happen with Ayurveda. I was like, I don't want this learning to become like every other learning I've done in my life where I just memorize something. And there's a different kind of learning. The people I think who really are very effective, whatever type of medicine you practice, it seems almost to me that they're able to really form a mental picture in their head about what's actually happening in your body, in the function of your body, what's creating it. This thing formed, but this was behind it and actually created that. And you have to get enough data to be able to do that. And what happens with a label, where you just have a label, it doesn't necessarily, I mean, you end up with a label at the end of it, right? But you don't know if the person actually went through the process of understanding the function that created the label, hence leading to a diagnosis. Do you think that's one of the reasons that like functional medicine has become so big right now?
Yeah, I think the rise of functional medicine, integrative medicine is a direct pushback from not just the healthcare field, but from patients saying, hey, I want someone to look at me as a whole individual and not just a system here or there. And I think that's where, in many ways, we've ultimately, the departure to become super subspecialized led to people being in silos. And so patients also feeling that they're left in these siloed, non whole person views. And so, yeah, I think that's part of why, personally, functional medicine, integrative medicine seems to me like it's what medicine was always described to be. I think what we're seeing is the terms are being used because they needed a new definition for describing sort of this personalized approach to healthcare. I think, unfortunately, in some ways, it's also been weaponized. And I think that's unfortunate because whenever people seek to go to the extremes of any end with a description is when you start getting into problems, when you start seeing a pushback even from the very persons who the thing was intended to help. And so what we've seen happening, sadly, with some aspects of functional medicine, integrative medicine, use of the word holistic and natural, is some of the students of those principles now thinking that it's either or. And I think whenever you go to either or is when you will end up isolating patients or you will end up causing harm. So similarly, right? on paper, I'm an allopathic physician, but I was raised in a community from the first day, from any first memories I had, that said they all go together. In fact, I wasn't born at a hospital, even though in my era, when I was born there in the late 70s in the Caribbean, pretty much everyone delivered at the hospital. But I wasn't born at the hospital. In fact, my mom was taken from the hospital and brought to one of our local spiritual midwives because they determined that that would be better. So from the moment I could remember myself, I understood that there were more layers to life and health and healing than simply the sort of allopathic box. And I think that's the way we do need to understand medicine. And so I think that's what functional medicine is presenting itself as. Where I do see, like I said, some departure from it is some people impose capitalism and the need to make money, etc. You can have a few bad actors who go to that extreme and it turns into I need to paint everything else horribly wrong with a big brush so that I can bring people over to my side to make this much money. But it's not the bulk of it. And so I think it's great. I love that people are taking charge, people want to know. One of the things that I've seen, if we go now to the context of COVID and the pandemic, is again where some functional medicine practitioners do again think it's an either or. So when we get to conversations around vaccines and masks and so forth, and you hear people telling people, well, no, if you just take these supplements or these particular herbals, you absolutely don't need to wash your hands. So believe in the washing hand business or the masking business. And that's where I think then you start going against sort of what are the natural holistic views of health, right? So has nothing to do with Western medicine versus Ayurvedic versus Oriental versus traditional, functional, lifestyle, integrative, whatever labels you want to call it. It means you're actually going against actual public health, which benefits everyone, not just one group. It's not, anyway, but that's what I would say to that.
Yeah, it does seem like the functional medicine community is skewing a little bit more anti-vaccine. I've noticed that. And yeah, I think that it's the part you're saying about supplements and herbals is if we're going to look at germ theory versus terrain theory, that it's not a versus, that it's both.
Exactly, exactly. And that's the thing that got me. So like every single supplement and herbal that has been brought forth as part of the armamentarium against COVID or viral infections and infections in general actually do the jobs they're supposed to do. I think what we're seeing, however, is, and it's not all functional medicine practitioners or holistic practitioners, and that's the unfortunate thing about anybody who becomes vocal, is suddenly they start to seem like the spokesperson for the field. And the truth is, the majority of functional medicine practitioners are not anti-vaxxers, they're not anti-medicine, they're not anti-healthcare, they're not anti-mask, but the ones who are vocal and going viral make it seem that way. And so I think that was one of the things that surprised me and saddened me because, again, like I'm an allopathic physician, I guess, on paper, but I've never not used my supplements and my herbals and my massage and you name it. I've always thought of these things not as complementary and alternative, but literally just complementary because they all go together hand in hand. I grew up in a community that said one hand doesn't clap. And I think when we talk about a person, we're talking about healthcare on every level, including looking at supplements, looking at nutrition, looking at activities, looking at our environment, and especially looking at that spiritual and mental health, right? But I've never believed it's either or. Like, I think it would be unfair and completely inhumane to tell someone that you got COVID because you didn't take enough vitamin D, or you got COVID because you took just too little vitamin C. That's not how that works. Similarly, someone not getting COVID isn't solely because of vaccines, but what we know is the vaccines are going to protect you from becoming quite sick. And of course, if you are someone doing your supplements and got vaccinated, you're doing yourself an even bigger favor. So I always have done my supplements, always do my exercise, etc. But yeah, I was one of the first to say, wear your mask. Let's wear masks. First to say, let's make sure we're practicing hygiene. And I was one of the first in line to get my vaccine after I reviewed the data. And I think that's really important. It's not either or, but what we see is we do have some people who are on the extremes. We have some who are on the extremes of absolutely no medical intervention. And then we have others out there who think if I have a vaccine, I don't need a mask, I don't need this, I don't need that, which is also not true. You need both.
Yeah, in my house, my partner is a PhD in biomedical science, so he tends to be on skewing one side and I skew a little bit toward the other side, and we have a child together, so we have to, have very heated discussions to sort of come to the same place. Yeah.
Yes, yes. And that's the thing, I think it's the opportunity to come to middle ground. One of the things that worries me is many people no longer try to find opportunities to get to the middle ground, right? Is I'm on this side, you're on that side. I'm right, you're right, but we're not talking to each other. And so you have two opposingly correct or right people if you listen to each of them, but neither of them with a solution. And I think that's what we're facing here. One of the things that I have been amazed by is I've had lots of conversations with people about vaccines. And the first thing I explain from the get go is as a vaccine immunologist and virologist, I recognize from the very beginning that not everybody is going to choose to get a vaccine. But what I do know is I have a duty to give accurate information and to make sure they've been given the full scope of the issue. That does not mean that when it comes to the public good, we don't have to consider that as well. And so whenever I speak of vaccines, sometimes I'll use the analogy of seat belts or drinking and driving drunk. Someone may be well within their right to drink and drive in terms of their personal feeling. But what they're not within their right to do is drink, drive, and harm others. And so we do have to put some safeguards in place so that you can enjoy your drink. You can still make your personal choice to drink, but we also have stopgap measures in place to ensure that you feeling like you can get behind the wheel doesn't result in you harming yourself. But again, your choice to drink probably means you're not necessarily concerned about the harm you could bring to yourself, but it's what that harm can do to other people, other communities, or members of your community. And so that's what I do when I talk about vaccines as well, because there are people who are like, well, I'm healthy, I'm fine. But we have to talk about vaccines as not just what it means for you, but what the risk of spread and infection means for the community and those around you who may not have the same access to resources to quickly get in to see a doctor, et cetera, as you. And of course, in the case of COVID, we still don't have a lot of effective treatments to clear infection early. It's still kind of up to your body to run its course and your systems and organs to respond how they're going to respond, and then we support your system and hope you ride through it. But we don't have anything that yet clears it completely, and there's nothing, not even a supplement or quote unquote alternative therapy that does that yet.
So, in terms of the research, since we're talking about COVID,
Mhm.
a couple of months ago, I remember there were some studies being started on women's menstrual cycles, and maybe it was even last year at this point, I can't remember. And obviously, there were a lot of women who noticed that month in which they got their shot, which happens with, other vaccines as well, not just the COVID vaccine, but
Vaccines and infections.
yeah, right. Because it's like, wait, you had a strong immune response.
Yeah, it's the immune system. And sadly, though, it's all about marketing and how that story got out there. And so, yes, we have a lot of people now who are of the belief that vaccines permanently impact your menstrual health or impact your fertility, etc., which is not true. Absolutely not true. They do not have a negative impact on your fertility. They do not have a negative impact on your menstruation. Specifically, also, what is never talked about is the actual impact that COVID, the disease, has on people's menstruation. And of course, what we're seeing COVID infection, the impact it's having on fertility and pregnancy, miscarriage risk, preterm loss, and stillbirth, not to mention death of the pregnant person.
Have the studies come out on that yet?
They have. So we have a lot of data, and a lot of data not from just one space. So within the US, we have data, but we have quite a bit of data now that's been accumulated from China, which, if we're remembering, the first case that was identified was in early December 2019. And by late December, the virus was fully identified. And by January, we actually had the World Health Organization saying, hey, this virus doesn't just cause an infection, it causes a constellation of disease symptoms that we're calling COVID-19. Because, of course, the virus isn't called COVID-19, it's SARS-CoV-2. Some people will get infected with SARS-CoV-2, but not go on to develop COVID-19 disease, or at least severe COVID-19 disease. And it's important that we distinguish that. But we do have data now from China, Italy, Spain, and lots of data coming out of the US, particularly data following the New York City peak that we saw in March, April of 2020. And so we do have quite a bit of data that we can look at in terms of what's happened in pregnancy, what's happened to pregnancies, the newborns, and the persons delivering them. But also, we actually have very specific data going all the way down to the molecular level, looking at eggs, human eggs, looking at sperm, looking at fertility, and no change in fertility as it relates to vaccination versus the active changes we've seen in egg function, ovarian function, testicular function.
If it feels like we've really just scratched the surface on this topic, well, you're in luck, because we're going to have a second episode as part of this series. It's going to be episode 64, where I air the second half of my interview with Dr. Cindy Duke, and we cover a lot more topics related to fertility and reproductive health. So join me here next week when that episode 64 airs. Thank you for tuning in and dropping in with us today. Don't forget to subscribe, rate, and review this podcast. I really want to hear your feedback. To learn more about my work, visit heathergrish.com. That's Heather, GRZYCH.com. And meet me here next time on The Wisdom of the Body.